Somebody want to catch this? You guys can pass it around. Nice catch. So that's the finished product of blood soup, okay? I'm gonna have Vanna White here help me out. She has our Ziploc bag. So what we do is we talk through what bone marrow is. And again, I'm using a lot of questions when I'm talking with young children about this. You could do blood soup with anybody as young as 4 years old, even younger if they're a mature 3-year-old. Of course, we want to developmentally make the conversation appropriate for that age. You can go into more detail as they get a little bit older. But we talk through bone marrow and how this is make-believe, this is pretend, this isn't real blood soup. And I always tease our kids about, would you, especially around Halloween time, how silly would it be if you had to eat blood soup? And I'll say at the end, okay, you'll have to eat it. And they all scream, and it's pretty funny. But we talk through bone marrow, and I'll say, well, where is the bone marrow in your body? Have you ever heard that word before? A lot of kids will say, I think that's in our bones, I think, right? I'll say, you're right. I want to show you guys this dog treat right here. Just kind of show what bone marrow is and where it is in the body. So we've got our bones right here, and then this squishy, spongy part right here on the inside part is our bone marrow. And what our bone marrow does, it's like a factory or a house that holds and stores and makes all of our blood in our body, okay? So this is our pretend bone marrow. It's a bag, but it's also our house or factory that holds and makes all of our blood cells in our body. Our first blood cell that we have, I always like to let them guess the color. So we've got our red blood cells. And I'll let them grab as many handfuls as they want. And what our red blood cells do is they carry oxygen through the blood, giving us lots of energy. Now, what I think is important to know is what I'll do with them is I'll say, now, if they carry oxygen through the blood and they give us lots of energy, what are something that you like to do when you have lots of energy? Kids love this. They're like, I love to ride my bike, I like to play football, I like to run. I'll say, that's awesome, that's your red blood cells working to give you that energy. And I'll say, well, what happens if we took some of those away? Do you think you'd have a lot of energy, or do you think you'd be feeling kind of tired? Maybe kind of sleepy. They'd say, you know, I bet I'd be feeling kind of sleepy. I'll be like, you're right. You're right. You would be feeling kind of sleepy if there weren't as many red blood cells. Our next blood cell, and this is every kid's favorite, are our white blood cells. And these are our fighters. These are like, especially if a kid is into war and soldiers, we talk about how these are our frontline men and women. They work hard to fight off being sick or fight off an infection. So we'll put some of our white blood cells in there. They're working real hard. And I'll say, what do you think would happen if we didn't have as many fighters? If they work hard to help fight off infection, if we didn't have as many, we took some of those men and women away, those fighters, do you think it'd be easier to get sick? And they would say, yes, it'd be really easy to get sick. And I'll say, well, what do you think we could do to help not get sick so much? What I want them to say is I want them to say the importance of washing our hands when we come into the hospital to see our loved one, or at home, making sure we wash our hands. But also, if this number is really low, it's a special name called neutropenia or neutropenic. And that means that our white blood cell count is so low that it's really easy to get sick. And we don't want that. So what we do is we wear a special mask when the patient or your loved one goes outside. Okay, and that helps protect them. It doesn't mean they smell or that other people smell, but it's to protect them from getting sick. Those are our white blood cells. We'll talk through our platelets, or rice. Sometimes kids try to eat this for real, and I always say, don't eat it. There's been tons of kids' hands in here. So our rice, or our platelets, they work together to help our blood clot. That's kind of a difficult concept for a child to understand. So we talk through when you have a lot of energy and you're running or you're on your bicycle, let's say you fall off your bicycle, what happens? And I'll say, it really hurts, I bleed. And I'm like, well, do you just keep bleeding for days and days? That's no fun. And they'll say, well, no, something brown pops up on it and I get a scab. And I'm like, that is awesome. That's what I want to hear, because what that is that's your body's platelets working to bring your blood together to form a clot, or your body's scabs. So that's really good, important to have. And then our last thing is our plasma. We talk about corn syrup, but we talk about, is this right here, is this a liquid or a solid? And I'll say it's liquid. And I'll say, good. What this does is this helps all the nutrients flow through our body like a river. That's why it's a liquid. It's made up mostly of water too, and that's also why it's a liquid. But it helps everything flow through our body. So then I'll have Miss Andrea mix that up, and we'll talk about how this is in all of our bodies. This is in everybody's body except for the patient, okay? And if it's a leukemia patient, what we can do is we'll bring in these big marshmallows here for a leukemia patient. We'll talk about cancer of the blood. When I put these marshmallows in here, I'll ask the kids, what do you notice that's different about these big old marshmallows and these other things inside the bag? And they'll say, well, they're really big. They're taking up a lot of space. That's exactly right. They're making it really difficult for your other blood cells to do what they were born to do their job. They're making it really hard. So we got to get rid of those. And cancer cells, what those are those are fast-growing cells in our body, okay? So blood soup, again, you can do this with leukemia patients, but you can also do this with any type of cancer. You can just have this without the marshmallows, and you can talk more of like a tumor basis, and we have tools to do that as well.